Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Rishika Barwa. India has recorded 43,654 new coronavirus cases. Now, this is a huge jump as compared to yesterday. These cases are 47% higher than what India reported yesterday. Now, yesterday, remember, India's cases dipped to below 30,000 for the first time in nearly 4 months. What explains this rise? Well, about 50% of India's daily cases, and the case tally today especially, is being reported from Kerala. So out of the 43,000 cases that India is reporting today, 22,129 new cases are from Kerala. And India has reported once again over 600 deaths. 640 deaths have been reported in this time period. 156 of those deaths are also from Kerala. Now, that's as far as the cases are concerned. But other big concern is that vaccinations have seen a huge dip in the last 24 hours. Yesterday, we saw 66 lakh people being vaccinated. We reported that they were almost, the vaccination was above 60 lakhs. And today, we're reporting that the vaccination is just above 40 lakhs. And the other cause of worry is, of course, that the R is at 0.99 now for the second straight day. The question is, are cases all set to rise in India? Are these early indicators? Because remember, this R factor is crucial. The reproduction rate essentially represents the average number of new infections caused by a single infected individual. So if the R is greater than 1, then the infection is able to spread in the population. Currently, we're inching closer to 1. But remember, this has happened all too quickly. That's the trajectory of the R on your screens. It's a parameter that is extremely important to watch when you're trying to understand the rise and fall in COVID-19 cases. And we'll, of course, continue to track that very closely. So this is as far as India is concerned. There has been, of course, this 47% jump in cases after a 4-month low. Kerala reporting 50% of these cases. But I want to shift our focus from India to what is happening in the UK, because it's extremely interesting to see what's happening in the UK at the moment. Now, the UK appears to have turned a corner. Cases in the UK have been declining for 7 straight days now. But just how are cases declining despite restrictions that have almost completely been lifted all over the UK? The government of the UK, remember, lifted all coronavirus curbs on the 19th of July. Yet their cases continue to decline now for 7 straight days. The UK Health Secretary, in fact, had warned of 100,000 daily infections and anticipated that, once UK lifts the curbs, cases could go up to 100,000 daily infections. So what really is the reason for the decline in cases in the UK despite relaxations being lifted? And most importantly, what is it that India can learn from what is happening in the UK? We have with us Professor Sanjeev Krishna, Professor of Molecular Parasitology and Medicine Infection at the Immunity Research Institute, St. George's University, London. We also have Dr. Rajesh Malhotra, the Chief of the COVID Facility Trauma Center at the All India Institute in Delhi. Thank you both very much for joining us. It's extremely fascinating to see, Professor Sanjeev Krishna, what is happening in the UK right now. And I read up a lot about it, and it's interesting because a lot of people are linking it to Euro. It's being linked to, the school season. But the truth is that there really isn't one correct answer to explain this phenomena. Cases dipping now for 7 straight days, despite UK having lifted all the curbs.
Yes, well, thank you for having me, Rishika. You're quite right. It's complicated. But the theme tune, the music that we are all listening to is vaccines, vaccines, vaccines. And that must have a huge underlying impact. And on this successful vaccine rollout, there are these other variables that you're mentioning, whether it's the end of the football watching for the Euros. Summertime has a beneficial effect. People are outside, people open windows, ventilation is better. And let's not forget, people are still, even though the restrictions have been lifted, people are still being careful. So we have all these other variables that are positive. What we really need to know also is through surveys carried out by the National Statistics Organization, we need to see how many people are genuinely infected. And that survey report will be coming towards the end of this week. But overall, what I notice is how quickly things have come down in terms of numbers. And, that might reflect the overall very welcome increase in immunity in the population in general. But it's early days, and we mustn't relax. And throughout the world, India also, wherever there is COVID, there's fuel still for the fire. And so we must take all the precautions that we know about already: space, face, ventilation, masking, and so on. Thank you.
All right. Well, Professor Krishna, stay on with us, because I also, want to understand how India should look at this. Dr. Malhotra, it's very fascinating to see what's happening in the UK. Cases rose in the UK. The government decided to lift COVID restrictions irrespective, very similar to what we saw here in India as well. A lot of governments really left with no option now but to lift restrictions, vaccinate as many people. What can India sort of learn from the UK example?
So, thank you, Rishika. There's a lot to learn. I think it's very fascinating, like you said. So, there are a lot of lessons to learn. One is, before this 1 week climb down, the cases had exceeded 50,000, and it was being predicted that they'll cross 100,000, like you said. But the fact is that it was expected because of the events and because of opening up. So one lesson is that when you open up, the cases are going to be on the rise. That's number one, which was happening. The second thing, now that it is reducing, we are looking at what's the cause. And I think you need to look at the second peak which we had, and the fact that even in UK now, the predominant strain is Delta strain. And you see the cases with Delta strain, they rise very fast and they come down very fast. And that's why you are seeing this, sharp decline in the cases. I would relate it to the type of infection which they are having there, which is the Delta strain which is happening there. The third thing is, the UK, in spite of still having more than 30,000 cases, is reporting just 65 deaths. And again, I will agree with Dr. Krishnan, the message is very clear here. On the other hand, if you look at Indonesia, with 40,000 cases a day, they have 1,400 deaths. So the fact that, the number of deaths are much fewer, even when the cases are more than 30,000, is the third lesson we have from UK, that the vaccination works, it reduces the deaths. And then, of course, the biggest message is you have to be on the lookout within the country, what is happening in Kerala, what is happening in Maharashtra, as well as what is happening in the UK and USA. We know that in India, large part of the infection is Delta, but Alpha and Kappa variant are there. So that's where your message is. And I hope you have answered your question.
You have indeed. And Professor Sanjeev Krishna, if I can bring you in here on the other important aspect, and you touched upon that in your opening comments, which is the fact that the UK government data, the National Statistics Organization data, says that 1 in 75 people on an average have been infected with COVID. So the sero prevalence in the UK, even across Wales, etc., is extremely high at the moment. Now, I want to just juxtapose that with what we're seeing in India, where we have, say, our fourth sero survey said that an average of 67% of our population, has antibodies. Do you think that the high sero prevalence in the UK could perhaps be one of the reasons why cases are coming down?
Yes, I think the presence of antibodies and its overall presence in the population is a very important factor. Now, what makes those antibodies? It's vaccines and it's infections, and I think the evidence is fairly strong that the vaccines give a much stronger protection than a natural infection does. Natural infections also protect. And we're still looking to see how long the protection will last for vaccines, and vaccines vary, and also from natural infections. People can become infected again, and there's always the risk that variants can escape. So during these critical times when things are changing, whether numbers are going up or indeed if they're coming down, fortunately, and I'm very happy to see the figures in the UK, even if the numbers are coming down, we must all still be careful, and we must all still watch day by day what's happening, and then be prepared to respond at an individual level to try and do our best to control the spread of this infection.
All right. Well, thank you both very much for joining us. It's extremely interesting to see what's happening in the UK at the moment, and especially the lessons that a country like India can learn when we're anticipating the onset of a third wave of COVID. Has the UK turned a corner indeed, or is it too early to say? We'll keep a close watch on those numbers. Thank you once again for joining us on NDTV.
Thank you.
Thank you.
All right, let's shift our focus now. Well, cases in the UK have come down, but cases in the United States, for instance, continue to rise. Now, cases in the UK are rising, in the US, I beg your pardon, are rising, and despite cases rising in the United States, now the CDC has had a rethink on masks. As cases rise, masks are back, even for fully vaccinated Americans. The US CDC has reversed an earlier relaxation on masks. The new rules say that masks are mandatory in areas with more than 50 cases per 100,000 for a period of 7 days. Masks are also mandatory now in areas which have more than 8% positivity rate for 7 straight days. Fully vaccinated people have to wear a mask in the US again. What does this essentially mean? Does it mean that the US CDC was perhaps too early to jump to a conclusion where it could ease mask restrictions? Dr. Ayeshta Dwivedi, the Assistant Professor of Medicine at the Lenox Hill Hospital, Northwell, joins us. Dr. Dwivedi, thanks so much for speaking with us. It's very interesting to see what's happened. Why do you think that the mask mandate has been reversed? I mean, we know that cases are rising, but can one perhaps link this to the Delta variant?
Hi, Rishita, and thank you for having me on the show. You're absolutely right. The CDC is revising its guidelines, and they're expected to come out next Tuesday. This obviously occurs in the setting of increased infections being seen, mostly because of the Delta variant and predominantly in unvaccinated people. Back in May, CDC had relaxed the guidelines for masking. Vaccinated people, indoors or outdoors, regardless of the gathering size, did not have to wear masks, meaning the mask mandates were lifted for vaccinated people. Now we've seen that about 50,000 new cases were recorded on July 26th, with about 33,000 new hospitalizations. In the setting of this new data, CDC is now recommending wearing masks regardless of the vaccination status, mostly indoors and in settings that are highly transmissible. Now, what these settings are remains to be seen when the guidelines come out. My guess is it's going to be public transportation, which already exists, hospitals and workplaces, which are indoors, and there's limited circulation.
Right. The CDC has also said that new data shows that while vaccines are highly effective, there are rare breakthrough infection cases that are being reported. This is, of course, connected to the Delta variant. What more is known about breakthrough infections in the United States at the moment? Is there definitive data to talk about breakthrough infections linked to the Delta variant?
Yes, nothing is perfect, and I preface this by saying that vaccinations are not 100% effective. What we know is that they are highly effective, meaning about 95% effective. That was shown in the clinical trials. That still leaves room for some breakthrough infections, unfortunately. Having said that, if you are vaccinated, the risk of you getting hospitalized or critically ill is extremely low. Right now, we're seeing that about 97% of the new infections are in unvaccinated people. And the few breakthrough infections that we have seen are mostly in the elderly or people with comorbidities, bringing into question, maybe we need a booster dose in the future, and this is currently being studied for people with compromised immune statuses or perhaps people of a certain age, but that remains to be seen.
Right. Do you think it was a mistake to have lifted the mask mandate in the first place? And what does this essentially tell us to the rest of the world, that masks are here to stay?
I think that's a great question. I wouldn't say it's a mistake. I think we just have to learn to evolve our lifestyle based on the situation of this pandemic. I think that cases were at an all-time low 2 months ago when the mandates were lifted. And now we have to revise the guidance and the guidelines based on the new Delta variant, which is about 80% of the new infections. So I think it's more we have to be adaptable during this pandemic. If something that's been important throughout the course of this pandemic. And also, I think we have to take it one day at a time. That's all I can say.
All right. We have to take it one day at a time. Thanks so much for joining us, Doctor. Also, like Dr. Anthony Fauci has said, that this is science. It keeps on evolving. It's not really a flip-flop. Short break here. We'll be back with more on the other side. Stay tuned. Welcome back onto our special campaign, Vaccinate India, in partnership with Google, where we're discussing questions you may have about the coronavirus vaccine. Dr. Gautam Bhansali, the Chief Coordinator, Private Hospitals in Mumbai and Consultant Physician at the Bombay Hospital, joins us. Thanks so much, Doctor, for being with us. Should mothers who have COVID continue to breastfeed?
Yes, definitely. Breastfeeding is very essential for the neonatal health, neonatal care and neonatal immunity also. So I will recommend that mothers who are suspected positive or COVID positive, they should continue breastfeeding with the proper care.
And how can they protect their newborns from getting COVID-19?
Yeah, they can protect their newborn with getting COVID-19 with the proper care. Like they should use proper sanitizer, they should use masking. In fact, they should use double masking while they are having coughing and all the things. But they should continue breastfeeding because that is having irreparable, or you can say irreplaceable nutritional value that is good for the newborn baby's health and the immunity.
Right, but just to understand this correctly, what should be the protocol? You're saying masking and sanitization is the protocol while feeding, but otherwise can the newborn continue to stay with the mother?
Yes, they can stay because they have good immunity, so they can stay with the mother. Even if newborn is positive or negative, doesn't matter. Even if mother is positive or negative, that doesn't matter. The newborn can stay with mother, whatever condition is there.
And post-COVID, once the mother has recovered from COVID, can she transfer the antibodies onto the newborn through breast milk?
So as of now, there is no as such evidence or no as such clear-cut guidelines regarding that vertical transmission from the mother to the children. So we are saying that chances of getting children affected by the mother is very, very minimal.
But what about antibodies? Can she transfer antibodies?
No, not yet. Not yet. There is no as such clear-cut evidence about the antibodies also.
Right. So if a mother has been fully vaccinated, also there is no chance that the antibodies could be transferred to the child?
No.
Right. The other question, doctor, that I want to ask you is about, the protocol. What should people do before and after vaccination? One of the most commonly asked questions is consumption of alcohol. Is it safe to consume alcohol before and after you get vaccinated?
So alcohol is having no relation with the vaccination. There is no any relation with the COVID infection also. They can consume alcohol, but in a minimal quantity. They should not have base alcohol. They should not drunk heavily after vaccination, because after the vaccination, people may get a little bit fatigue. They may get little bit tiredness. They may get little mild fever. So they should not have heavy alcohol. They can take mild consumption, but it's better if they can avoid alcohol for 2 to 3 days.
So you're saying avoid alcohol ideally for 2 to 3 days before and after vaccination?
Yes, they should avoid ideally.
All right, both before and after?
Before and after vaccination.
Right. What about people who have allergies? Is it safe for them to consume alcohol before and after?
People who are having allergy?
People who have allergies.
Yeah, people who are having allergy, they should strictly avoid alcohol.
Right.
Before and after vaccination.
What about people who are on blood thinners?
Yeah, people who are on blood thinners, they can take vaccine, but they should avoid alcohol.
All right. So you're saying essentially that people who have some kind of a special condition should perhaps avoid alcohol before or after vaccination?
Yeah, it's always better to avoid alcohol. Ideally 5 days prior to vaccine and 5 days post vaccination.
What is
always better.
Right. What are some of the reactions that could happen if one didn't avoid it?
Yeah, if they don't avoid, then chances of getting that nausea, vomiting, mild fever, fatigueness, that chances are very high. And if the continuous persistent vomiting is there, abdominal cramps, that kind of situation may develop. So ideally they should avoid.
And does it affect the antibody count in any way?
Generally, no.
Right. So you're saying that it has no impact on the antibodies, or what about people who get very severe reactions after getting vaccinated? What do you recommend? And this is not a question per se connected to alcohol, but what do you recommend to people who get, say, very high fever or severe headaches after they get vaccinated? What should they do?
So if any kind of reaction may happen, that will happen generally in the next 30 minutes to 45 minutes or 1 day, you can say, maximum.
Right.
That's why we recommend always that all the vaccination center who is having ICU care, they are only giving the authorized vaccination center.
Okay.
Even if you are getting any kind of allergy, any kind of rashes, any kind of reaction like high blood pressure or some sort of giddiness is there, you should consult to your doctor. If any kind of allergic reaction happen, within half an hour or 1 hour, they give Avil, Efcolin, that kind of medications.
Okay.
But chances of getting allergic reaction or some other kind of heavy reaction after 24 hours is very, very minimal.
All right. Well,
but yes, if fever is there, if high grade fever is there, headache is there, we are recommending simple paracetamol tablet for 2 to 3 days.
All right. Okay. Thank you so much, doctor, for joining us. Thank you.
Thank you. Welcome.